Welcome to the series of educational videos, Germanische Heilkunde, by Dr. Med. Gerd Hummer. My name is Helmut Pilhar. I am the father of Olivia and one by Dr. Hummer appointed lecturer on the Germanische Heilkunde theory. Dr. Hummer's Germanische Heilkunde not only explains how our body works, but also indicates why we think, act, and feel the way we do. The combination of two sensible biological special programs furthermore results in a biological supersense. This theme points in the direction of character explanation. The various constellations like panic attacks, megalomania, paranoia, disorientation, waking coma, are explained by case studies. The aim is to understand why people are the way they are, and what we can do under certain circumstances. You can learn more about this in the approximately 1-hour educational video. Ladies and gentlemen, I welcome you to our series of educational videos on Germanische Heilkunde by Dr. Med. Gerd Hummer, MD. Our topic today, constellations outside the territorial area. Dr. Hummer explains how our body works and why we think, act, and feel the way we do. Why is one person paranoid, or another is in megalomania? And it is about higher mathematics, when it comes to solving a constellation. A constellation has a certain stability due to its tracks. So far, I know of only mind student Machen from Dr. Hummer, which can at least downgrade the cortical conflicts in the cerebral cortex, which means lesser conflicts can then be resolved more easily. It is best to listen to mind student Machen around the clock, quietly at night, so you can sleep. You'll also have completely different dreams. Just try it once. Nothing dangerous can happen with student Machen, says Dr. Hummer. So this would be the therapy that everyone can easily apply to themselves. In the chart, and in the chart book, the different constellations are explained. There are 3 levels in Germanische Heilkunde. The organ level, the brain level, and the psyche, in everyone. The organs and the psyche are inseparable, and any medicine that does not take this into account is incomplete. Conventional medicine limits itself only to the organ level, and it does not really see a connection between the organ level and the psyche. But in reality, they are inseparable. There is no organ disease without a correlation in the psyche, and vice versa. And we still have a 3rd level, which is the brain level, and that always works synchronously, on all 3 levels. We only consider the levels, so we can work with them more easily. In reality, they are inseparable from the individual. If I know one level, I can determine the other levels. So, for example, if I see an X-ray, and I see osteolysis in the bones, on the right and left, then I know that he has megalomania. Or, if I see from the psyche, someone always turns around and always looks backward, he is paranoid. Then I know, in his brain CT, he has the fear and the neck conflict in the visual cortex, and I also know the eyes are involved, on the organ level. So, if I know one level, I can determine the other levels. The therapist in Germanische Heilkunde will always consider all 3 levels. He must be able to read an organ CT, read a brain CT, and be able to put himself into the psyche of a small child, of a cheated wife, and a bankrupt businessman. The cause of the diseases that arise on their own is a single biological conflict shock, which is highly acute, dramatic, isolative, and the person is caught on the wrong foot. This is the cause of cancer, allergies, chronic diseases, and also for psychoses. Every psychosis starts with a conflict shock, a Hummer focus in the brain. And now, a sensible biological special program starts on the organ level, which should help me solve the cause. For example, breast cancer should help me make the sick child healthy. And if the child becomes healthy, the cell division stops. And in the healing phase, the node is degraded with TB bacteria. And at the end of the healing phase, I am also healthy in terms of conventional medicine. The conventional physician then has nothing to diagnose. So this good-evil does not exist in Germanische Heilkunde. Nature does not do anything good or bad, but always something sensible, and the combination of 2 sensible biological special programs results in a biological supersense. That which we used to say, he is crazy, that is the supersense. So when do we speak of a constellation? When there is a Hummer focus active, on the right and the left hemispheres in the brain, which is disc-shaped. The brain vibrates in a normal rhythm. If I have a conflict, this conflict vibrates one half of the brain out of the normal rhythm, and because the other half of the brain continues to vibrate in the normal rhythm, I am not yet constellation crazy. Let's say I have two different conflicts, and each conflict has a different conflict content. For example, one conflict is with the mother, the other conflict is with the dad. Each conflict forces the brain hemispheres out of their normal rhythm. I have now fulfilled the condition for the constellation. Both brain hemispheres vibrate out of the normal rhythm and vibrate differently from each other. From now on I have a constellation, and I have psychosis. I am maybe in megalomania. Or I am paranoid. Or I am disoriented. We see this condition again, after I resolve one of the two conflicts and enter the epicrisis. The epicrisis is similar to being conflict active. Every special program has its own unique epicrisis. These epicrises are always brain-driven events and symptoms. In the yellow group, I have a brainstem epicrisis. In the orange group, the cerebral medulla. But the more ominous epicrises are from the cerebral cortex, such as being absent-minded, having epilepsy, etc. But I have an epicrisis in every program, about in the middle of the healing phase. And the patient in the epicrisis is cold. The biological sense is, to prevent him from falling into vagatonia, and to steer the boat toward health. The epicrisis always occurs in the middle of the healing phase. Depending on the intensity of the conflict, the crisis can have two spikes, yet you don't always notice them. It can last for 1, 2, 3, or 4 days. In one hemisphere I have an active Hummer focus, and on the other side, I have an epicrisis. I am then in psychosis for the time of the epicrisis, and I am also crazy. Or, if both conflicts get into the epicrisis at the same time, then I am crazy for the time of the epicrisis. This can be a split second, or last even for a few days. It looks a little bit different from a so-called central conflict. So, I can have a Hummer focus over both hemispheres of the brain. For example, if I suffer a conflict at the same time with dad and mom, then I have partner and mother-child side involved, at the same time. And then I have a Hummer focus over both hemispheres of the brain. And the one conflict forces both hemispheres of the brain equally out of basic rhythm. But they don't vibrate differently from each other. I am not crazy. Or alcohol, which also forces the brain out of its normal rhythm. If I also have a conflict that explicitly forces the brain out of its normal rhythm, and I drink alcohol, then the condition is also fulfilled. Both halves of the brain vibrate out of the normal rhythm, and are different from each other. These are the people who, woe to them, drink alcohol. They are otherwise quite normal with a conflict, but as soon as they drink alcohol, then they go crazy. Either they become very aggressive, or they start crying, or they are just laughing. Or even a brain injury. An injury to the brain forces one half of the brain out of its normal rhythm, but irreversibly. I can solve a Hummer focus. But a brain injury, that is irreversible. The other half of the brain still oscillates in the normal rhythm, and if someone with a brain injury drinks alcohol, then I also have a crazy person in front of me. He better not drink alcohol. Or, if he has a brain injury and still has a Hummer focus on the opposite side, he can also be off. Also, in an epicrisis, you have to pay attention if a conflict is still active on the other side at the same time. Or if one enters the epicrisis with a conflict on the left and on the right side at the same time, then one is in a constellation. And then one has the psychic symptoms of the respective constellation, for the time of the epicrisis. So, and in this group in the territorial area, we have a Hummer focus on the right, and a Hummer focus on the left in the brain. The territorial areas are female on the left, and male on the right. With men, with women, it is the same. In left-handed people, and right-handed people, it is the same. But we have very crucial peculiarities here. Maturation stop. With the occurrence of the second conflict in the territorial area, the emotional maturity stops, we remain childish. Intellectually we could finish university studies, but we remain childish. We also look younger with a baby face. It stops the conflict load, it stops cancer, and we are manic depressive. So these three peculiarities. 1. The stop of emotional maturity. 2. The stop of the conflict load. And 3. Manic depressive, which only plays out in the territorial area constellations. Not outside the territorial areas. However, and today we are discussing only outside the territorial areas. So, with paranoia, no cancer stops. We don't stop from maturity, and we're not manic depressive. So, let's start with paranoia. We're here in the visual cortex, so at the very back of the cerebral cortex. And there we have left and right retinal halves. On the right retinal half. And on the left retinal halves of both eyes, and the vitreous body. In the retina we have a functional loss, which is a loss of vision in the conflict active phase. In the healing phase, we have retinal detachment, more or less in macular degeneration. I have a black dot everywhere I look. And, at the end of the healing, the scarring results in nearsightedness and farsightedness. That's the retina, fear in the neck of something, of schoolwork. And in the vitreous body there is glaucoma, which is the loss of the visual field. In the healing phase in glaucoma, that's fear of the predator, so for example the teacher. If the student has the fear in the neck from schoolwork, that's a thing, not a person, then the retina is affected. Or he has the fear of the predator, in this case of the teacher. He's got it in for me. Then the vitreous is affected. And we have these 4 brain relays, and in principle also these 4 possible combinations. All 4 result in the overcautiousness delusion. For example, the woman being chased through the park by the rapist. Fear in the neck of the thing, fear in the neck of the robber. Suppose she suffers such a paranoid constellation. And although she knows that the perpetrators are in jail, this woman does not go through any park anymore, because, and this is the point, it could actually happen again. So these patients then purposefully avoid any situation that reminds them of that event. And you can tell this woman 100 times, there is nobody in the park. And she still doesn't go through it, because it could happen again at any time. And that is the biological supersense. You consistently avoid that situation. And she then perceives a rapist sitting behind every bush, once a constellation has occurred. A conflict is not resolved until it can no longer happen. And a second, a third rape can happen again at any time. So once a constellation has occurred, to crack such a nut is very, very difficult. And you can't reach the patient even with logic, so you can't get through to them. This patient was a member of an organization, actively involved in suppressing Dr. Hummer and his discoveries. He warned Hummer of a planned attempt on his life, and he also knew very well what would happen to him in return. In this brain CT, you can see very clearly the Hummer focus. I'll try to show this. The red arrow on the left of the center at the very bottom that points to the center, and around it, there is the Hummer focus. And the same on this one, there's the center here, and around here is where the Hummer focus goes like this. I'm going to draw it in briefly. Here is where the Hummer focus is, a sharp closed circle. You can see this one thing nicely as well. I hope you have a high resolution screen. And this one, it goes here. So this man knew what to expect, and he always has pushed the closet in front of the door, before he went to bed. But this could not save him. Hummer mentioned this case and this person in his habilitation, a kind of postdoctoral thesis, at European universities. And this boy got into a persecution delusion, because of a movie. Because of a movie. Hummer writes, in the CT, we recognize, arrows left and right, occipital, 2 fear in the neck conflicts, which are half and half in resolution. He keeps experiencing recurrences. The so-called persecutory delusion. Yes, right and left. He has drawn it in here in dashed lines. The CT of the eyeballs, respectively the vitreous and the left retina, is very impressive. The left eye, right arrow, is very interesting, because it marks a retinal detachment, which is a sign of healing. It is the fear of a thing, not a person. At the same time, the left arrow is still occurring due to the opacity in the vitreous body. So, this boy has seen a movie, in which a madman stole children from their beds, that is, kidnapped. And in the right eye, the arrow points to a healing process. The release of the vitreous opacity, which is always accompanied by so-called glaucoma. That is, with an increase in pressure in the vitreous body. So that during the healing phase, the vitreous body remains stretched, and not collapsed. We previously considered this glaucoma as a disease, but now we understand it as a healing phase symptom. So this patient also has the vitreous body involved. And in the brain, the CT shows it on both halves of the retina, each for the left and right eyes. And he has thus also suffered a conflict in the territorial areas, and he has thus come into a territorial area constellation. This boy has stopped in his maturity development. He saw the film when he was 8. And he is 13. His mother said, he is like an 8-year-old. He behaves like an 8-year-old boy. So with just one movie, he has suffered many, many conflicts. So, that was the persecution mania. People who wear glasses, of course, also suffered a fear in the neck conflict, and with conflict relapses the scar tissue builds which affects the ability to see. At the end of the healing process, the scarring remains. And as a result, one remains defective in vision, which must be corrected with glasses. It is possible that the case is over and the program is completed. But the scarring remains, and with it the defective vision. And it does not even have to be a constellation. Let me show you the eye. The retina program involves functional loss. Here we have these two relays for the retina, left and right. The right relay controls the two right halves of the retina, and the left relay controls the two left halves of the retina. If I have a fear in my neck regarding a partner, the little blue man on the right is supposed to be the partner. And I'm right-handed, so I see the partner standing to my right. And his picture is imaged on the left half of the retina. And I have my Hummer focus on the left side in my brain. The nervous connection is crossed over, from the left brain, to the right organ level on my right partner side. With fear in the neck, concerning a partner. If I can resolve it, then I have a retinal detachment on the right and on the left side, which then scars after conflict resolution. And then I have the same dioptric number, on the right and on the left side, and I would need a similar prescription of glasses on both sides. So, just because both eyes are involved, doesn't mean I have a constellation. The both left retinal halves look to the right, and the both right retinal halves look to the left. These belong to the partner or mother-child. And that is why most of the time you have the same eyeglass prescription, in both eyes. Then, the frontal constellation. This is the frontal fear, the danger that is crashing down on me, from the front and fainting. You can't do anything about it. Let's say, there is an earthquake. And you see the skyscraper swaying, and the danger of what's coming at you. And you're powerless, you can't do anything about it. And you're afraid of the future. What does tomorrow bring? A very troublesome constellation is the fronto-occipital constellation. The danger from the front, and from behind. Fear in the neck, and the frontal fear. These people no longer take a step outside the door, in extreme cases. This is, when people have panic attacks via the tracks. I can get into such a constellation again at any time. So, for example, the woman who was raped, and she had the perfume of the rapist stored as a track. While the rape was years ago, if she smells the perfume of the rapist, immediately, the fronto-occipital constellation returns, and this woman has a panic attack out of the blue. And she doesn't even know why. She doesn't recognize the connection between perfume, the rapist, and her constellation. These are panic attacks. And Hummer writes, this 42-year-old left-handed patient was diagnosed with melanoma on her neck. When she was told that it would be necessary to also cut out some healthy tissue, she went into a complete panic. She had already had a fright conflict before, the large arrow in the upper right, she is left-handed, so the conflict impacts on the opposite side. In the process, she suffered another frontal anxiety conflict, left frontal, that little Hummer focus. And a fear in the neck conflict, right cerebral, retinal and vitreous. She raced all over Europe in wild panic. We managed to calm her down. For a while, she saw badly with her left eye, respectively vitreous. Since then, everything has returned to normal. So, they kind of put all their eggs in one basket. I myself was also once in this constellation, for hours. And of course, I also had a fear in the net conflict. I was a bit paranoid. These are the war wounds, the experiences and the impacts that one has over the course of time. A journalist couple pretended to be parents of a child with cancer, and went to see Siegfried Mohr in Cologne, an alternative practitioner. They filmed him with a hidden camera. Siegfried asked on the phone to change the child's diagnosis, and these journalists filmed it and broadcast it. That's why the public prosecutor's office investigated Mohr. So it really doesn't get any dirtier than that. The same team then went to Daniela Armsters in Switzerland, Angelo's mother. She was also a Hummer therapist, among other things. The bell rings at her front door, she opens the front door and in comes the camera, spotlight, and mic. What do you say about the death of Hummer? This was an actual assault at the front door. And this Hummer therapist, Daniela Armsters, she emailed this incident to me. On that day, my wife and I wanted to go to a seminar, together to Germany for the first time. That meant, our children would have been alone at home for the first time on the weekend. That was at the beginning of 2000. I received the email from Daniela Armsters from Switzerland, and we wanted to leave on Friday, so we could lead our usual evening study circle in Vienna. On Friday, I get a call at noon, asking whether the study circle will actually take place in the evening. I hear the accent on the phone, that's a German. That's not Viennese, that's a German. And I still think to myself, what is a German doing at the study circle in Vienna? Then he calls a second time an hour later, to ask whether there are enough parking lots? And that was my frontal fear. I thought, now the TV truck is coming. So I say to him, you're German. He says, yes, we are coming via Bratislava. So, we, plural. And those were the journalists to me, who would attend the study circle in Vienna. That was my frontal fear. And in that constellation, you put all your eggs in one basket. And I went to my daughter's room and said, we are going away for the weekend, and if journalists come here to the house, don't open the door, call the police immediately, trespassing. My daughters looked at me in horror, kind of like, now he's going completely crazy. Then I went to see my mother-in-law. I wrote down the police number for her in big letters, and gave her appropriate instructions. And the grandma said, not again, not again, not again. She also caught all the media hype at that time, live, media rush. Then we drove to Vienna, to the study group. And I thought, what am I doing? My wife tried to calm me down and said, oh Helmut, maybe that's not a journalist at all. I say, we have 50 study circles in Germany. What are Germans doing in Vienna? And then I had an idea. I would simply say that, it is customary for everyone to introduce themselves at this study circle. So if I have a journalist standing in front, then I would ask him a few questions. And that was my strategy. In fact, a man was sitting there, a head taller than everyone else. And I go to the study circle leader, who is a lovely person, but she's kind of, well. Anyway, I instructed her to keep an eye on this man. Not to let him film along with a cell phone camera or anything. And my study circle leader says, him? I say, yeah, I think that's the one. She then walks up to this man and asks him, tell me, are you a journalist? I thought I was going to be blown away. He says, no, I'm not a journalist. I know Mr. Pilhar. My parents have been to his seminars, I have been to his seminars. And then I take a closer look, and he really looks familiar. This German was married in Bratislava and lives in Slovakia. And he drove 1 hour by car to Vienna because of the study circle. And I thought he was a journalist. That was the most relaxed study circle ever. And at about 4 a.m., I woke up and had a cramp at the top of my chest. I was drenched in sweat. Ice cold sweat. A cramp like a brick was turning over. And my wife thought I had a heart attack. That cramp lasted a quarter of an hour. But I know this cramp, and I know it from the pharyngeal ducts. In the pharyngeal ducts, there is squamous epithelium, which ulcerates during the conflict active phase. This is, by the way, a remnant from the history of development of the embryo. Parts of this have been shut down, parts of this have been converted into the coronary vessels, arteries, veins, aortic arch, carotid externa and interna. Parts of it are immobilized and it looks like a rosary, a cord with a knot on it. In the past, it was thought to be a lymph node, until it was found out that it was not a lymph node. And now, this healing phase cyst is called non-Hodgkin's in conventional medicine. In the active phase, the squamous epithelium ulcerates. And in the healing phase, it is repaired in the swelling. This healing phase cyst is called non-Hodgkin's, non-lymphoid cancer in conventional medicine, because it is the squamous epithelium. I am also familiar with migraines. I was beaten up as a child for being a bedwetter. And the frontal fear and the spasm, those are muscular parts. This is also frontal fear. I know all three programs from my own experience. This string with knots has no functioning today, but we still have this program. And it is a special program from the history of our development. Then the cramp was over. Without swelling and without migraine, because it was just muscle involvement. So, for hours I was caught in this constellation. And that was really intense, it was horrible. Then we have the motor constellation. We have motor function here. For example, if I have paralysis on the right leg, then I have my Hummer focus here. Imagine a gigantic one. Latin, homunculus. And if I have a Hummer focus active on the right and on the left, then, of course, I also have paralysis on both sides. Either the arms, or the legs, or the arms and legs. And Hummer writes, a motor schizophrenic cerebral cortex constellation simply means that there is motor paralysis on both halves of the body. It is usually referred to as MS. If, in between, there were shorter or longer resolutions for one of the two sides, then it was called epilepsy. For example, if a man's wife runs away and takes their children as well, then a right-handed man may suffer paralysis of the flexor muscles of the right arm, from when his beloved wife has run out. But at the same time, he can also suffer paralysis of the flexor muscles of the left mother-child arm, from because his children have run out. Such a man can be, from one moment to the other in the schizophrenic cerebral cortex constellation. He would then constantly obsess over holding everyone, embracing them in his arms. While in reality, he is less and less able to do so. The muscles atrophy in the active phase, due to necroses. This is called muscular dystrophy in conventional medicine. ALS is another term for it. And when both hemispheres come into the epicrisis at the same time, then this person has a tic. A tic is always a double epicrisis of the motor function, concerning the musculature. The sensory cortex is a double conflict of separation. And Hummer writes, there is something special here, a psychosocial state of emergency. I can't imagine much about it. He didn't give examples of that in such detail either. Alright, we come to the cerebral medulla. We stay in the cerebrum, or cerebral cortex, but we come to the cerebral medulla. This is below the cortical center, here on the diagnostic chart. The cerebral medulla controls the connective tissue, and the musculoskeletal system including bones, tendons, cartilage and muscles. And there we are in the deluxe group. Usually, the biological purpose with the deluxe group is only at the end of healing. That means, there I have to resolve the conflict first, get through the healing phase, and only then does the biological sense serve me, but it serves me for the rest of my life. So in the active phase, the tissue necrotizes. In bones, it is called osteolysis. In tendons, necrosis. In muscles, necrosis, that is cell loss. If I can't solve a self-devaluation collapse, then at some point the bone breaks, it tears the tendon, and then I get eaten. With this group, nature does not help immediately. First I have to solve the self-devaluation conflict. The surgeons of nature are called bacteria in the healing phase, and they fill up the necrosis during the swelling. That hurts. And at the end of healing, the swelling goes down, but the bone remains stronger, the tendon remains stronger, for life. So it doesn't occur as easily again. So the biological purpose is only at the end of healing, but functional strengthening remains the same for a lifetime. Therefore it's known as the deluxe group. And, if one suffers a double self-devaluation conflict, one on the partner side and one on the opposite mother-child side, then one would think, he is only 1 foot tall, even with a hat. Exactly not. Now comes the biological supersense. Now you are Napoleon. You are completely convinced of yourself. In the megalomania, you can pull yourself out of the swamp as if by your own hair. So when the gym teacher says to Max, "Max, you are a total failure in sports." And this is a conflict to Max, a self-devaluation conflict. Highly acute, isolative, and caught on the wrong foot. He has a sports self-devaluation collapse that hits the knee, partner side. The gym teacher is a partner. And the mother says, "Max, you really can't do anything." And he suffers a self-value collapse concerning his mother. Now he is in megalomania. He is Arnold Schwarzenegger, and entirely convinced of himself. He throws himself into the sporting competition and can actually win. And now he stands on the podium. He really is the best, and can thereby solve the self-devaluation conflicts. Normally, in any other constellation, when one of the two conflicts is resolved, the constellation is gone and doesn't come back until the epicrisis. But not in the deluxe group. In the deluxe group, the delusion of megalomania remains until the end of the healing phase, to be able to get through this very painful healing phase more easily. If you say to me, "The right side of my shoulder hurts, and the left side of my hip hurts," then I know that both the partner and the mother-child side are in healing, but still, the delusion of megalomania remains. Then I know you are in megalomania, and then I just greet you with, "Hail, Caesar." So as I said, we can infer from the organ level to the psyche in the same way. So this is the super sense of megalomania here. I once talked to 2 cancer patients. They each had a high dose of chemo. Do you know what high dose chemo means? You eradicate the entire bone marrow. That is pure slaughter. But ultimately 0 bone marrow remains. So much for the theory. And then they give stem cells and firmly believe that they will migrate into the bone marrow, and sprout again like radishes, and produce blood. Those who survive, do so only because the bone marrow was not completely eradicated. And only 1 out of 100 survives this slaughter. And one of them had a metal plate inserted into the skull, and an iron rod in the thigh, which was a bilateral self-esteem collapse. The other cancer patient had lymph nodes on the right and left side, which is also a self-devaluation conflict. Hodgkin's disease is the cure. But because this was also bilateral, there was megalomania. The interesting thing is that, one survived for 9 years, and the other for 1 year. Both said they knew chemo couldn't hurt them. And that's kind of megalomania too. So they got tons of chemo. It knocks out the strongest bull. But that was their belief, that chemo couldn't hurt them. At a lecture, I had to carry in book boxes. And in front of me walked a young Italian, with patent leather shoes and dark pants, white shirt and beret, slanted on his head. And he had such a very strutting gait. And I'm walking behind him, and I'm thinking to myself, I wonder if he has megalomania? And after the lecture, this very man comes running up to me and says, "Mr. Pilhar, I've been through all this madness of chemotherapy." He had Hodgkin's disease when he was 12 years old. I asked him where he had the affected lymph nodes, on the right and left of the neck, and the right and left of the armpit. On the neck, that's the humiliation to the mother. One side belongs to the mom. And if it's the mother on one side, then it usually follows that it's the father on the partner side. So the issue is towards mom and dad. And the shoulder always means, I'm a terrible child to the mom and a bad partner to the dad. So I explained to him about the organ level, and his girlfriend says, "I'm sure that was because your parents used to beat you up so badly back then." And that may very well be the reason, if both mom and dad were hurting at 12-year-old. Self-value can collapse on both sides. So, you can see a lot of things from a person's behavior if you have a bit of an idea of all this. We are still in the cerebral medulla. There is also the testicle or ovary, which is a loss through death or departure of something that is alive. It can also be an animal, but not a car or a bicycle. It must be something living, and the handedness is taken into consideration. Do I have partner loss, or mother-child loss? And if both sides necrotize, the man is infertile. And the woman is also infertile, she is not ovulating. That's like cutting off the man's testicles, or cutting out the woman's ovaries. And they then have a sexual superiority mania. He may have testicles the size of cherry pits, but he is convinced he is the very best. Once we had a study group leader who had both testicles necrotized. He was unable to procreate, and he and his girlfriend spent a week with Hummer. Hummer recommended to his girlfriend that she should look for a lovely producer for her child, and then come back. She just had to change the stallion. Yes, if the man is unable to procreate, then you have to change the stallion. And that's what this woman really did. Only she didn't come back, bad luck. The study circle leader with both testicles necrotized walked around in a wraparound skirt. Shamelessly on the sidewalk, and without underpants. I mean, you couldn't see much. Then he sat cross-legged on the chair so that you could see all the goods. I mean, there wasn't much to see, because they were very small. But there was no sense of shame at all, that is, the sexual superiority mania. I wouldn't dare to do that. I would never think of wearing a wrap skirt, as a man. So, then we get into the cerebellum. The cerebellum programs have cell proliferation in the active phase, and the cerebrum or cerebral cortex programs have cell loss, or functional loss. So, we look at the developmental history backward and there is only one cerebellum constellation that is known, and that is double breast cancer. From the literature we have a double worry struggle with both, the partner and the mother-child. This woman had breast cancer on both, the right and the left breasts. And the conflicts were as follows. The daughter came to visit with her family, and the mother made a lot of effort with cooking and preparing. The daughter didn't like the food and she said, "Mother, next time we'll go out to eat." And that was the argument with the daughter. And thereupon her husband, with whom there was never a bad word, he says to her, "You stupid old woman." Bam! That was the argument with the partner. This woman had caught two arguments conflicts in a short time, right and left. And later when she was with Hummer, it was all resolved. And Hummer asked her if she had done anything crazy during the conflict active time. Then she fudged a little bit and said, so in retrospect, yes. There was one instance, that was kind of crazy of me. Her dog had fleas. And she invited friends for coffee, but only those who also had a dog. Because she wanted the fleas from her dog to jump over to the other dogs. So in that constellation, you have antisocial behavior. One is emotionally burned out, emotionally dead. Not capable of any feeling. And that is antisocial behavior. That is directly antisocial and underhanded. Let's look at the brainstem, which is always about the morsel. The handedness has no influence at all. But, right in and left out. You always have to think of the worm from the history of development. And, if I get into a constellation here. That is, I don't get one morsel that I want to have, and another morsel that I have and want to get rid of, but I can't get rid of. Now I have an active conflict on the right, and one opposite of my brain's left side. So I have two active Hummer focus. And now I'm shocked, stunned. So they're sitting at the kitchen table and staring in terror. And you have the feeling that they would like to throw up, but there is no point in throwing up. So they are bewildered and stunned. I have one case of this. The patient had a relapse, an old colon cancer. So he had a recurrence with colon cancer when the neighbor child pooped on his patio. So that's really a crap conflict, and that was the recurrence for the colon, the left brain stem side. This was followed by the diagnosis of colon cancer, and the diagnosis of colon cancer he can't get rid of. Because of the colon cancer diagnosis he had the liver active, on the right side. This fear is, I will not get enough food. And now he was active with the liver, and not at all with the intestine. And with the information morsel, with the middle ear and the brainstem constellation, so he was dismayed and stunned. Hummer further writes. Until the final diagnosis, it is, quite benign, the patient sat stunned in the same place for 10 days, not knowing where he could go. He had no disorientation, but was frozen. This is the stupor. And he woke up from all of that, when he was told this is relatively benign, and thus he got rid of the nugget of information, the label of colon cancer, and thus was out of the constellation. A special brainstem constellation is that of the kidney collecting tubes, which presents as disorientation. Local, temporal disorientation. So the conflict is the refugee, the existence conflict. We always have to understand the programs from the history of development. This program is about water storage. And this program ran in our ancestors, who still lived in the primeval sea. When does such an animal have to store water? When it lies on the coast and threatens to dry up. It can no longer find its way back to the saving sea. And that is now the refugee conflict. And where I am, I don't feel at home, and I am left absolutely alone. It is about my existence. And then the kidneys are closing up the collecting tubes. The patient is very thirsty and does not pee. The program now says, drink every puddle and don't pee. The next flood is sure to come. And so that the little animal does not crawl away, there is a paralysis in an eye muscle. This is called abducens paralysis. The cranial nerve abducens passes through these brain relays. This nerve moves the eyes. And now there is an abducens palsy, and one eye moves outward. If you look closely into the eyes of a person, you notice that one eye is looking past me. And then you know, it's the right eye and right renal collecting tube relay. This is a refugee conflict active. And so that the little animal does not crawl away, nature pulls the eyes of the little animal to the side. So it can't even look straight ahead and becomes so disoriented. The little animal doesn't know, where should I crawl to? The little animal stays on the spot, drinks every puddle, does not pee. The next flood will surely come. Then it is washed back into the saving sea. Ah, I'm home again, and immediately the constellation is solved. The eyes go straight again, the disorientation is gone, the kidney collecting tubes open again, and it excretes the stored water again. So this is the supersense. Question: do the constellations always have to affect the same levels of the brain? We always speak of the same level. Hummer says it can be quite possible that a brain relay from the brainstem also makes a certain constellation with the cerebral cortex. But this is unknown. It is quite possible, however. We have about 500 brain relays, and multiple possibilities of combinations. So, A and B and A and C and A and D and B and C and B and D and B and E and C and E, and so on. These are the types of possible combinations. Immense, crazy, amazing. But unfortunately, only some of them are known. So, this is the supersense, the disorientation. These are the people who walk along the corridor, and don't know which door they want to open. Even though they have walked through it 100 times. Or, they go to the intersection and again do not know, do I have to turn right or left? Or they go out of the shopping mall, and don't know where they park the car. Or they constantly run into something. Or they are disoriented in time, they don't know where they were yesterday, what date it is. They can't be on time, and they're time disoriented. And that's also the waking coma. In the case from the book Student Mei Chen, the patient also came to the seminar 1 year later. She had the so-called choroid plexus in healing. So, here on the upper brain CT, you can see the grayish color. This is a glandular tissue in the ventricles. They make cerebrospinal fluid. This is a real brain tumor. So glandular tissue is what creates cell proliferation. But there is no brain tumor in the sense that there is no nerve cell division. But these are not nerves either. This is a real yellow glandular tissue that makes cerebral spinal fluid. And the conflict is, on the right, I want to flow in where I can't reach. And on the left, I want to flow out where I can't get out. So I would like to get into the clique, but they won't let me. Or, I want to get a new job, but I can't leave. She had the conflict of not feeling comfortable at the workplace at all. After she changed jobs, that was the solution and she entered the healing phase. Nevertheless, she continued to be in the clinic. Because of her 2 kidney tubular conflicts she was disoriented. One conflict was, because she was a former East German citizen. When the wall came down, she went to the west, but wanted to go back to her beloved, old East Germany. As soon as she returned, she experienced that this was no longer the East Germany she knew from back then. That was her first refugee conflict. And her second existence conflict was with her life partner, who was a long-term unemployed man. He got a job once, and was out of it the very next day. Those were her 2 kidney tube conflicts. With that, she was in the hospital, disoriented in a vegetative state and about to have brain surgery. So she was incapacitated. They were not married, and the life partner knew she would never want to have brain surgery in her life. But there was nothing he could do. However, he pressed the student HN into her ears. And that's about the only thing she could remember, from the time she was in what we call an awake coma. They talked to her. Her responses were delayed, but she can't remember all of that. The weekend before the brain surgery, the lawyer came to check on her on Sunday. What kind of lawyer does that? And he realizes, well, she's back in full force. She was able to solve the constellation and was back to her normal self. He reverses the incapacitation. She packs her bags and escapes from the clinic, 2 days before the brain surgery. And after that, they did a brain CT. Nothing was seen. They would have cut out her brain for nothing. For absolutely nothing, nothing at all. And 1 year later, she was at my seminar with her life partner, and that's when I met her. And she also had one eye deviated, and the other one looked straight again. And as I said, there's a slight disorientation, but you have to look carefully if you know what to look for. This study circle leader has had his study circle in an inn for 2 years. And he invited me to a seminar. He walks in front of me through the hallway, there are a few doors, and he looks where he needs to go in. And again the next day, and again the day after that. I already knew where to go in there. And so I asked him, "Are you disoriented?" Besides, he's skinny as a whip. He certainly doesn't store a drop of water. What else is there other than possibility that he's storing urea? The renal collecting tubes can store water or urea, but then the creatinine would be elevated. He was interested in that. If you are a study group leader, you are interested in that, of course. Therefore, he had a blood count done, the creatinine value was at 1, and that was normal. He does not store a gram of water. The creatinine value is 1, which means he doesn't store urea either. But he is obviously disoriented. I noticed it. And then he sends his brain CT to Hummer, and Hummer confirms to me he has both kidney collecting tubes active. So, in this case the psychosis has occurred, even though he's not storing water, urea, or creatinine, but in the other case with the eyes, and the following case it was the water retention program. Also, there are shades of gray, regarding which physical changes occur, which depend on what the conflict content meant to your psyche. If the kidney collection tubes store protein, then the conflict is an existence conflict. If they store water, it is a refugee conflict. And I, for example, also had these kidney collecting tubes. I stored water because I felt pretty much left alone with the attacks of Antifa. And so, that's why I stored water. That's also an excellent case from the literature. It's one of my favorite cases. Because there I can show you something beautiful. This woman had the 1 kidney tube conflict since childhood. It was post-war, bitter poverty, a large family. And there it was customary to divide the children among the relatives, so that they could be fed. And she was supposed to go to Aunt Clara. She was wealthy and childless. But the child did not want that. That was a horrible idea to her. There she was, the refugee. She didn't even have to go to this Aunt Clara, but whenever she was naughty they threatened her. If you're not good, you'll go to Aunt Clara. And so they kept the conflict going for her. She was then married to a veterinarian, who got brain scans for multiple odd billy goats, or even once a sheep. He was a real Hummer fan, and he knew Germanische Heilkunde very, very well. There are also a few such testimonials on the homepage. So, they went on vacation once. From the north to the south of Germany. And there, she suffered her second refugee conflict, and she was suddenly disoriented. And her husband notices that she does not know at all where they were. Even at the resort, she didn't know her way around at all. So he thought Dr. Hummer would break off the vacation. So he breaks off the vacation and returns home. She gets out of the car, and doesn't recognize her own house. He was already slightly nervous and he reflected. With the chickens in the chicken coop. She spends most of her time with her beloved chickens, in the chicken coop. He grabs his wife, walks through the garden to the chicken coop, and there the curtain lifted. She recognized that and said, "Oh, Gustav, we're home again." That's when she was able to resolve the two conflicts, and the psychosis left immediately. And if you now take just this one case. For this local disorientation you would need a renowned psychiatrist. The kidney failure would be a case for kidney specialists. Renal tubular carcinoma is the job of the oncologist, the specialist. This abducens paralysis, that's where we have the brain specialists working on it, and in the healing phase we have renal tuberculosis, and we need an internist for that. We need 5 to 6 renowned specialist physicians, working in conventional medicine, who can no longer see the forest for the trees. In reality, all you have to do is, take the lady by the hand and go with her to the hen house. And that will solve all the problems. Once I know what the boogeyman is, I can pull the lever in such a way that the program in my brain switches to healing. It would often be that simple. But conventional medicine can make a mountain out of a molehill. One more question about the vegetative state: when the conflicts have built up a large conflict load, or is the conflict content decisive? Why it comes in this constellation once to the disorientation in time, then again to local disorientation. Or why it leads once to the waking coma. With the occurrence of the second conflict, the constellation is running. If there is urea storage, that is the existence conflict. If there is water storage, that is the refugee conflict. But why does the time disorientation occur in one case, and in another case occurs the spatial disorientation? Unfortunately, I can't answer. Nor why in some cases the waking coma occurs. Maybe it has something to do with the intensity of the conflicts, or there is still a particular nuance in the conflict content. That would be a question directly to Dr. Hummer. But unfortunately, we can't ask that anymore. By the way, Hummer himself also had this constellation. There was the famous Hummer quarter hour. All students who had taken Hammer seminars know the famous quarter hour. It is like this. The seminar with Hummer starts at 10 a.m. The participants are already 15 minutes before. It is 10 a.m. You don't see or hear anything from Hummer. It is 11 a.m., and you don't see or hear anything from Hummer. It is 12, Hummer is still not there. It gets to be 12:30 p.m. and Hummer dances in. And the seminar participants say, "Nice that you are there, but look at the clock." Hummer says, "Oh, because of the quarter hour, we'll make up for it." It's a conflict he describes in his book, One Against All. His mother gave him away to his aunt in Friesland, on the seacoast. There is also a photo of him, as a 4-year-old. He was quite grumpy. And his track was the sea air. When he smells sea air, the kidney collection tube's close. I'm afraid I don't know for sure what the second conflict was. But the participants were always glad when Pilhar drove Hummer to the seminar. Then, he was at least almost on time. So from Alhoren, where he lived, to Doremelin was about an hour's journey. And it was 9 a.m. And I tell Gerd, "We have to go." He says, yes, I'm coming." And I walk to the car, and he doesn't come. So I look for him, and he was just feeding the goats. And if he feeds the goats, then he has to feed the pigeons too. Okay, we are only 15 minutes late. And as we drive through Alhoren, he remembers he still has to go to the post office. Because the post office is closed in the evening. First, 15 minutes late, now 30 minutes late, and so on. People with such a constellation cannot be on time. And, one time we got to the seminar 10 minutes ahead of time, so I say to him, "Well, Gerd, either my watch is wrong, or we are on time?" He says, "Yes, ever since I installed the new windows, I haven't smelled the salt air." Also he has less kidney pain, and he is excreting water. So, he built a house in Spain that was sealed with plastic sheeting. Once the windows were installed, he felt comfortable. By the way, he built everything open, with many windows. I guess the imprisonment was at least part of his refugee conflict. So everything was open, that's where he was comfortable, that's when he was on time. So that's the story of Hummer's 15 minutes. The lateness only exists in the kidney tube's constellation, nowhere else. Alright, ladies and gentlemen. I am through with the material on this subject. I thank you for your interest, and would be glad to welcome you here again. Otherwise, I wish you a nice evening. Helmut Pilhar.